Thank you, Mr. President. Mr. President, as you well know, I come to the floor each week with a doctor's second opinion, and it specifically relates to the health care law, the law that was passed now over a year ago with many promises made by the President, one of which was that if you like your coverage, you can keep it. We now know that's not the case, as he had promised. He also talked about this driving down the cost of health care, and we've seen the cost of health care going up. Last week I came to the Senate floor, Mr. President, and talked about the something that's not really known very well. It's a part of this law. It's called the so-called Independent Payment Advisory Board. And I gave 5 specifics as to problems with this board. So today I'd like to give another 5. And I think these are things that every single American needs to know about the mandates that are part of this health care law and what's going to happen to them as more and more components and parts of this health care law are implemented. This is called, people refer to it as IPAB, IPAB, not an iPod, but an IPAB, and it stands for the so-called Independent Payment Advisory Board. But I'll tell you, this is a Washington board. It is not independent, and I believe it's going to be very harmful in terms of the health of the American people. This board often goes unnoticed, and one of the reasons is it actually doesn't become operational until after the 2012 elections, until 2013. But it is an extremely powerful and extremely dangerous part of the President's health care law. It's a Washington board. It empowers 15 unelected and unaccountable bureaucrats, 15 full-time Washington bureaucrats who will decide how Medicare dollars are spent. These Washington bureaucrats will use basically price controls, and they will use price controls to ration medical care and services all across the country. You know, you remember, Mr. President, when then Speaker of the House Nancy Pelosi said first you had to pass the bill before you got to find out what was in it. Well, now as more and more Americans learn about this rationing board, they will again voice their opposition to the President's health care law. I will tell you, Mr. President, I want to pick up today where I left off last week. I'm going to share with the American people an additional 5 things that they need to know about this board. And the number 1 thing today is that the President wants to keep this board under the radar. He and his administration simply want to disguise the long-term impact that this board's price controls will have on our seniors on Medicare. If he does so successfully, well, the patients on Medicare will be the big losers. He wants to promise the American people that the board will achieve great Medicare savings. But he doesn't want to explain to the American people exactly what those Medicare cuts will do and how the American people will ultimately pay the price in their health care. The President and Washington Democrats have historically supported policies giving government the power to set health care prices. But make no mistake, the President is using this Washington board as a Trojan horse to accomplish that goal. This is exactly why this board is not going to be set up until after the 2012 elections. The American people will not face the true impact of this board and the cuts that's going to have on their loved ones until after the presidential election next year. The President's plan depends entirely on keeping the true purpose of this rationing board well below the radar. Here's a second concern, and that is that the opposition to the President's Payment Advisory Board, interestingly enough, is bipartisan. Even members of the President's own party know that creating a Washington board to cut Medicare payments and ration medical services is bad policy when it comes to our seniors. Even Representative Pete Stark of California, ranking member of the Ways and Means Committee in the House, and is on the Health Subcommittee, said April of this year, New York Times article, quote, "In its effort to limit the growth of Medicare spending, the board is likely to set inadequate payment rates for health care providers, which could endanger patient care. There you have a member of ranking stature, Democrat Party in the House. Now let's take a look at what someone else said. She announced her support for legislation which would repeal the President's Payment Advisory Board. This is Representative Allison Schwartz of Pennsylvania. Now, actually, she's a strong champion for the health care law. She's also vice chairman of the new Democrat coalition, and she had a statement that came out April 15th, 2011, Income Tax Day, saying, Congress is a representative body and must assume responsibility for legislating sound health care policy for Medicare beneficiaries, including those policies related to the payment systems. Abdicating this responsibility undermines our ability to represent our constituents. She goes on to say, I cannot condone the implementation of a flawed policy that will risk beneficiary access to care. Third, the President's Payment Advisory Board, it sets prices and it gives Washington more power, not patients. In most cases, Medicare payments to doctors, and members of the Senate, both parties understand this, are already well below market rates. That is why doctors often limit the number of Medicare patients that they see. In more severe cases, doctors stop treating new Medicare patients. Well, allowing a rationing board unlimited power to control Medicare prices, it's only going to drive Medicare payments lower, and it's going to drive more doctors away from seeing Medicare patients. And my concern is that the prices are going to be driven so low by this rationing board that the government will force doctors, hospitals, and other medical providers to stop offering any care to Medicare patients. Random and punishing cuts to Medicare provider payments won't make this program any more efficient, won't make people's health care better, but it will reduce the supply of medical care to our seniors on Medicare. The Washington Board's ability to set prices gives it unprecedented control over personal medical decisions, and that's wrong. Those decisions should be left to the patient and his or her doctor alone, without the interference of 15 Washington bureaucrats. No Washington bureaucrat should ever have the right to stand between a patient and his or her doctor. At its core, the debate about the President's Payment Advisory Board centers around a few questions. Do the American people want a Washington board of unelected people that they don't know making their personal health care choices for them? Or do they want to have the freedom and the choice to make their own health care decisions? And do they want the members of Congress, the people that they send to Washington, to be able and to be held accountable? Do they want those members of Congress to explain exactly what spending cuts are being discussed and need to be made to ensure Medicare's solvency? As you know, Mr. President, we all heard just last week, Medicare is going to be bankrupt even 5 weeks faster than it had been thought in the past. Interestingly enough, and this is number 4, Mr. President, President Obama doubles down on on the President's Payment Advisory Board. In his April 13th spending speech to the nation, he doubled down on his commitment to this Washington rationing board. In the speech, he said he actually wants to give the board more power to slash Medicare payments to providers. Apparently, expanding his rationing board is one of the only tangible proposals that the President has to reform Medicare and reduce the debt. The American people sent us here to confront our financial and fiscal crisis head on and to come up with solutions to solve the problem. They didn't send us here to cower behind boards and commissions and empty promises. They asked us to come to Washington with the courage, the strength, and the political will, Mr. President, to make tough spending decisions. Rather than stand up to the challenge, the President chose to go all in, placing his bet on 15 bureaucrats yet to be identified. He asked the American people to trust him that this rationing board will squeeze out Medicare savings. At the same time, not impacting, he says, our seniors' access to medical care. But I don't think this is a bet that our nation's seniors should take or should be willing to take. And finally, Mr. President, number 5, members of my party, the Republicans, are working to repeal the President's Payment Advisory Board. Senate Republicans are taking a stand against this rationing board, against more government control. Senator John Cornyn of Texas has introduced Senate Bill 668. It is the Healthcare Bureaucrats Elimination Act. This bill repeals the President's Payment Advisory Board, ensuring Medicare patients can get the care they need from the doctor that they choose. And I'm proud to be a co-sponsor, an original co-sponsor of this piece of legislation. And that's why, Mr. President, I come to you today again on the floor with a doctor's second opinion as somebody who for a quarter of a century in Wyoming has taken care of patients on Medicare, many patients on Medicare, to provide a doctor's second opinion that this health care law is bad for those patients. It's bad for providers, the nurses and doctors who take care of those patients, and it's bad for the taxpayers. With that, Mr. President, I yield the floor.